Assalamualaikum warahmatullahi wabarakatuh and a very good morning to everyone. So today our group will be presenting about blood bank test 2 assignment. Next. Okay, this is the list of our members. Next. So in this presentation, we will start with the introduction. Then we will give 2 examples of transfusion reactions and we will proceed with the treatments and management, and lastly Q&A. This is the question that we received from Dr. Elysha. If incompatible blood is given during a transfusion, the body will treat the donor cells and as foreign invaders. How does the immune system react to foreign bodies? Explain this by giving 2 examples of transfusion reactions that affect the body and if there is any treatment. So there will be a role play for this presentation.
Okay, let's begin our role play. Welcome students to our hematology department of our hospital. So today I'm Dr. Hagilan and this is Dr. Elysha will be guiding you throughout this practical at hematology department. Would you mind to introduce yourself to our fellow doctors and also nurses?
Alright, I will introduce myself. My name is Nur Aimiliana binti Abdul Aziz. I am from Universiti Putra, Malaysia, and I will be having practical here. So I need guide from doctors and nurses.
Hello, Dr. and nurses. My name is Nur Safa Elysha binti Sarudin, and I am from Universiti Putra, Malaysia. So please be kind to us.
Sure. Nice to meet you, Miss Safa and also Miss Aimi. Hopefully you will learn something from this practical. I'm Dr. about the theory, and the nurses, both of the nurses will be explaining about the treatment. And please be careful, students, at the end of the explanation you will be given some questions so that you have to be answered at the moment. If not, your marks will be deducted. Okay. As for introduction for today, the blood transfusion can be defined as the transfer of blood or blood components from a donor to a recipient. A blood is usually transferred to the patient who has undergone severe blood loss due to accidents or during surgery. Blood can be divided into 3 components, which are red blood cell, plasma, and also platelets. Hence, the saying goes, one blood can save 3 lives. And transfusion reactions can be defined as an adverse event that happens during or after transfusion of blood. As the reaction occur during the transfusion are termed as acute transfusion reactions, while the reaction that happen after a while is termed as delayed transfusion reactions. It can be classified as immunologic or non-immunologic and might be difficult to be diagnosed because the symptoms are very non-specific and also overlapping. You may proceed, Dr. Elysha.
Okay, thank you, Dr. Hagilan. So I will explain about the first example of the transfusion reactions, which is hemolytic transfusion reaction or HTR. This is the destruction of incompatible red blood cells. Next. So this transfusion reaction happened due to mismatch or incompatibility of the patient with the donor products, and the severity depends on the alloantibodies, quantity of the antigen transfused, and the ability to activate the complement system. So in this reaction, the hemolysis, there are 2 types of hemolysis that can happen, which are intravascular and extravascular. So for intravascular hemolysis, it occurs when the antibody to the red blood cell antigen binds and causes complement activation, and the RBC will be ruptured within the circulation and release hemoglobin into the plasma. As for extravascular hemolysis, it occurs when the antibody to the RBC antigen can opsonize the RBC and leads to their sequestration and phagocytosis by macrophages and other phagocytes of the reticuloendothelial system, which are the liver and spleen. And the RBC will decrease within the macrophage and hemoglobin is not released into the cytoplasm. Next. Okay, for this HDR, there are two types which are acute and delayed. For acute, it occurs within 24 hours of transfusion. And the usual incompatibility happens in blood group ABO, but reactions can also occur with other antigens such as Duffy and Cal. The recipient's antibodies bind to the antigens that cannot be found on their red blood cell surface. But exposure to other antigens previously, such as during pregnancy, other transfusions, or needle sticks, can also trigger this reaction towards other antigens besides the ABO group. For the delayed hemolytic reaction, it occurs 2 weeks after the transfusion, but it also can go up to 30 days post-transfusion. This reaction is normally caused when the immune system responds to the transfusion of foreign red cell antigens, such as during pregnancy or prior transfusions in delayed timeline. Hemolysis is mostly extravascular for delayed and less clinically dramatic compared to the acute hemolytic reaction. And the implicated antigens are usually minor antigens like the rhesus antigens. Next, Dr. Hagilan will explain.
Thank you for the splendid explanation, HTR, Dr. Lisa. And now I'm going to explain about febrile non-hemolytic transfusion reaction, which is a destruction of incompatible donor white blood cells. FNHTR can be defined as a sudden unexpected reaction occurs during or after transfusion of white blood cells. When a recipient receives an incompatible white blood cell, the recipient's white cells recognize the transfused cells as foreign cells, thus induces an immune response towards them. There are two mechanisms that are responsible for this immune response, which are the mechanism induced by human the first mechanism inducing and this binding induces a secretion endotoxins, and this secreted endotoxins induces hypothalamus to stimulate a fever, resulting in an increase of body temperature. The recipients are the leukocytes increase the production of leukocyte cytokines during the storage of cellular components. And the symptoms of this transfusion reactions occurs during or after 2 hours after the transfusion. The first symptom will be the sudden increase in the body temperature, where the body temperature increases the normal body temperature, which is 37 degrees Celsius, more than 37 degrees Celsius. And then the symptoms are prolonged fever, where the patient will fall into a fever which continues up to 12 hours, associated with chills and rigor. And other symptoms that patients may be facing or may be presenting is headache or tachycardia, which also associated with fevers and chills. Okay, I'll give the presentation towards the nurses for you to explain the treatment and management.
Okay, thank you, Dr. Hagile and Dr. Lisa for inviting us in this session. So, hello students. And so we will discuss on the treatment and management. So firstly, I will start with the hemolytic transfusion reaction. So for HDR, we will provide them supportive care for the HDR patient, either it is both acute or delayed type. So first of all, when you encounter a patient with HDR, you have to stop the transfusion. And then if you observe that the symptoms are getting severe, so you have to start resuscitation. And then, for example, if the patient receives a large volume or a large amount of incompatible RBC, So you can consider to give the patient RBC exchange therapy. So the reason is that we want to reduce the circulating incompatible RBC burden and also to limit the hemolysis. Other than that, we also have to provide normal saline to the patient. This is to maintain the urine output of the patient. So the importance in maintaining the urine output is that to prevent the likelihood of compilation of free hemoglobin in the bloodstream. So other than that, let's say you see a sign of disseminated intravascular coagulation in the patient, so you can give them plasma and platelet product to encounter the problems. So I guess that's all for the HTR reaction. So I will pass to my colleague Muna to explain the next reaction.
Thank you, Anis, for the explanation of the first reaction. I will be talking about the second reaction, the treatment of the second reaction, which is the febrile non-hemolytic transfusion reaction. So there are actually four steps that we have to take into account to tackle this problem or to tackle this reaction. So the first one is to discontinue the transfusion. So we have to stop the transfusion immediately. There are certain symptoms that are triggered with the febrile non-hemolytic transfusion reaction, such as the fever, allergic reaction, headache, and all of that. So I'm going to talk about how to treat this kind of symptoms or what to do to tackle them. So if you, in the case of fever, oral acetaminophen is take 325 to 500 milligram may be administered orally to reduce the fever. But we have to be cautious in this. So not any antibiotic medicine can be taken, because in the case of aspirin, it has an adverse effect on as it can affect the platelet function. So we have to be cautious with the types of antibiotic medicines that can reduce the fever. The second symptom that can occur is the allergic reaction. And how we tackle that, we can use the medicine diphenhydramine that can use to relieve the rashes and hives associated with the reaction that can happen. And the fourth one is anaphylactic reaction. So in this case, there is a standardized treatment that has to be taken in, which is the subcutaneous injection of epinephrine, 0.3 to 0.5 ml of 1 to 1,000 aqueous solution. All of this can be prevented or reduced with the use of antibiotic such as paracetamol and antihistamine such as diphenhydramine prior to the transfusion reaction. And usually these are taken 30 minutes before the transfusion reaction, so that these symptoms or febrile non-hemolytic transfusion reaction will not happen during the transfusion. And next.
Thank you, fellow nurses, for the splendid explanation for the treatments and management. Students, are you ready for your questions?
Yes, you are ready.
Yes.
Okay, the first question will be, what is the difference between hemolytic transfusion reaction, HTR, and febrile non-hemolytic transfusion reactions, FNHTR, with a brief explanation for each transfusion reactions?
Okay, I will answer this question, Dr. Agilan. Okay, for HTR, hemolytic transfusion reaction, it is a destruction of incompatible red blood cells, while febrile non-hemolytic transfusion reaction is the destruction of incompatible donor white blood cells. Okay. Okay, this for the brief explanation of HTR. Okay, this transfusion reaction is happen due to mismatch or incompatibility of the patient with the donor products. There are two types of HTR, which are intravascular and extravascular. The reaction also involves two types, which are acute and delayed, depending on the alloantibodies, quantity of antigen transfused, and the ability to activate the complement. I have read about HDR. So what I have found is HDR reaction which donor red blood cells are destroyed by antibodies in the recipient's circulation. Other than that, the red blood cells incompatibility may also occur when patients' red blood cells antigen are attacked by donor's plasma antibodies. For febrile non-hemolytic transfusion reaction, okay, there are two mechanisms as Dr. Hagilan have stated earlier. The two mechanisms that are responsible for this immune response are the recipient's antibodies bind to the donor human leukocyte antigens of leukocyte cytokines by white blood cells during storage of cellular components. Okay, that's all for question 1.
Dr. Lisa, do you have any questions to ask?
Okay, I want to ask another question for Safa. So, what are the initial steps taken when a transfusion reaction is suspected?
So I will answer the question. Sorry. Transfusion reaction require immediate recognition, laboratory investigation, and clinical management if a transfusion reaction is suspected during blood administration. The safest practice is to stop the transfusion. A transfusion reaction investigation should be performed, and at the same time, supportive care and treatment are provided depending on the patient's condition. So this is the additional information of treatment and management that I have read and found somewhere for the specific reaction. First is the acute hemolytic transfusion reaction antibody mediated, where the transfusion need to stop immediately when the signs or symptoms are present. Then anticipate hypotension, renal failure, and disseminated intravascular coagulation. Prophylactic measure will be taken to reduce the risk of renal failure, include giving the low dose of dopamine to the patient, vigorous hydration with crystal-like solution, and osmotic diuresis with 20% mannitol. If DIC is documented and bleeding requires treatment, transfusion of frozen plasma, pool cryoprecipitates for fibrinogens, and platelet concentrates may be indicated. Next is the acute hemolytic transfusion reaction, non-antibody mediated, where diuresis is induced by an infusion of 500 milliliter of 0.9% sodium chloride per hour, or as tolerated by the patient until the intense red color of hemoglobinuria ceases, which is usually adequate the treatment. Lastly is the delayed hemolytic transfusion reaction. This treatment will be provided to the patient either alone or in combination, which include intravenous immunoglobulin, recombinant erythropoietin, corticosteroid, rituximab for patients who have developed alloimmunization after DHDR. So it will prevent further alloimmunization. And lastly, eculizumab for some life-threatening episode.
Okay, students, do you have anything to conclude?
So to sum up, transfusion reaction might happen as adverse events during or after the blood transfusion if there is any incompatibilities between the blood of donors and recipients, which can range from mild reaction to life-threatening emergencies. Early detection of transfusion reaction can help in reducing the risk of adverse effect, which could harm the patient's health, as treatment and supportive care can be provided to the patient.
Okay, congrats to you. You Congrats, students. Bravo. I will give. You have given us specific and splendid explanations for the questions, and I will be thinking about giving you a bonus marks for your practical marks.
Thank you, Doctor.
Thank you, Doctor.
Oh, you're welcome, students. And that's all from us. Thank you.
Thank you. Bye.
Bye, students. And febrile non-hemolytic transfusion reaction for this binding. I'm really sorry, guys. I have to record again. Oh my God.